the microphone and video permission to the browser that you used last time.
Okay.
I think that's anyway. Yeah. Try to set up try to do the live streaming to various channels right now. Facebook, YouTube. More importantly, it's the WeChat Live, because a lot of I don't know if you heard. There's some celebrity gossip. One of the TV show actress that tried to give up her parentage while her surrogates, two of her surrogates, were 7 months pregnant or so. It's a kind of a So everybody's talking about that. So everybody questioning about the legality, of a surrogacy or the the ethical issues. So it's been a hot topic. So pretty sure we're gonna have a large audience from that side, the WeChat. So
what is your agency saying about that? Like, I mean, obviously with all the legal contracts and everything.
Really in the States, because we, the legal system represent the best interest of minor children. So there's no undoing your parentage. Once established, and then it's yours. It's your obligation to reach the adulthood. So we did a little video with Brian Klein, the attorney in San Diego. So he did we did a little podcast style interview, and we translated it, posted it, pretty much to tell the parents, we have a pretty that's how our legal system set up, to protect minor children. So I think but I think the main thing the audience will care about is how she, because they didn't understand. They thought she already given up her parentage, but that's not what happened. She's still the the legal parent of the two surrogate children, but it just she just didn't hasn't taken her responsibility yet. Because what happened is you both the parents gotta sign a consent form for their children to travel back to China, but she just refused to come to the state and sign the documents. I think that's why the baby dad is trapped here in the States. It's one of the hot topics trending Chinese news right now.
Yeah, no, that's what I hear.
Yeah. All right. Yeah. Whenever you're ready, Dr. Becht, we can get it started. I think we got a. Let me check on the WeChat. I think connection's good. Okay. All right.
All right, I'm ready.
All right. All right. Good afternoon, everybody, and good morning to our audiences. Hold on, 1 second. You recorded. I'm sorry. Let me do it again. Good morning or good afternoon to the audience from the States. Today, we joining us, Dr. Lisa Becht from HRC Fertility. Dr. Becht got her medical degree from Georgetown University, and she went through her medical residence in Columbia University, both the OBGYN department, also the reproductive endocrinologist. And she's been practicing since 2016, and she recently relocated to Newport Beach, California, and joined the HRC, one of the biggest IVF chains in the United States. Many of the audience has already heard of. And today we'll be talking about, pretty much she will cover the overview, the ins and outs of in vitro fertilization, and I will take over the surrogacy and egg donation part. Today, just recently, there's a lot of news, especially the celebrity news, come from the Chinese side. The many audiences question about the legality of surrogacy and egg donation, and the ethical issues behind IVF and surrogacy. So I'm pretty sure a lot of audiences have questions. We will get it all answered during our FAQ sessions after the presentation of our main content. So without further ado, Dr. Becht,
All right. Well, hi, everyone. It's such a pleasure to be talking to you all. So I'm so excited to be talking about IVF and kind of how that relates to surrogacy. And definitely, like Bai said, I'm excited to take all questions. So definitely feel free to write in so we can make sure that you get all the information you're here for tonight. So we're to start with kind of a brief overview. Thank you for the kind introduction. But in terms of what we're going to be talking about tonight, we're going to go through the in vitro fertilization treatment cycle in detail, and kind of with that, just go from step to step so you can be fully understanding whether if you're going through an IVF cycle, if you're having an egg donor, what she would be going through, and then how that then translates to then getting pregnant, whether you're carrying the pregnancy or if you're having a surrogate. Let's go into the next page. So in terms of IVF, in vitro fertilization, kind of sometimes classically people call it kind of test tube babies. And so the point of IVF is basically to take the eggs out of the ovaries of the female, combine with sperm from the man, and then in our lab, we're able to then maximize all the success rates by basically combining sperm and eggs, growing embryos, and then doing testing of those embryos typically to really maximize success. And so here at HRC, we have the highest rates on the West Coast, kind of with a normal chromosome embryo. When we do that transfer to get someone pregnant, it's typically successful over 75% of the time. With a consult going through your specific information, I could give you a little better specific to you and your situation, what that success rate would be. But definitely very high success rates. And because we're working with eggs and sperm in our laboratory, that gives us the ability, if we're going to use an egg donor, that gives us the embryo. So if we're going to use a surrogate, kind of this is the whole process that we do it so that we can basically maximize all success. On the screen, kind of on the bottom, you'll see an interesting picture. Basically, eggs, sperm, embryos are all microscopic. So everything is done in our lab under the microscope with micropipettes. And then over kind of on the right of the screen, you can see the really interesting process of ICSI or ICSI or intracytoplasmic sperm injection. And that's literally injecting the best moving and best looking sperm into the egg to try to ensure fertilization, meaning that they come together correctly. In terms of the actual IVF process, it's definitely a little bit of a complicated one, so I'll try to simplify it here. But really, the first part of IVF starts with trying to get as many eggs as we can get out of the ovaries. And so in terms of how many can we get, technically the more the better. But basically that process, we have you or your egg donor do injections, and the injections are basically going to make the ovary grow in terms of all those follicles so that we can then take the eggs out. So in terms of that, we do monitoring, which is ultrasounds and blood work every couple of mornings. And with that, we're able to watch the ovaries with the follicles growing. And from that, we're going to titrate around the doses of medication personalized to you or the egg donor to really get the maximal response for you or the egg donor. Usually it's about 10 days of injections. Definitely in terms of side effects, possibly some kind of increased bloating or cramping, but typically most people tolerate it well. At the end of that, when those eggs are ready, you take a special trigger shot to get the eggs ready to come out. And at the end of it, we do the egg retrieval. And that is basically when I'm going to take the eggs out. It's through the vagina, which I know sounds a little anatomically interesting, but you can see on the picture here that basically the ovaries come down to each side of the vagina so that the needle can literally go right through the vaginal wall into the ovary to take the fluid with the eggs out from both sides. It's about a 10 to 15 minute procedure. It is done under sedation, which is kind of twilight, which is just a minimal type of anesthesia, but the patient is fully comfortable in sleeping during it. And after that, those eggs are then going to be combined with sperm to fertilize and make embryos. We grow the embryos for a week in our lab, and any of the ones that make it to the end, we're then going to do the chromosome testing for. That's called pre-implantation genetic testing, or PGT. That is extremely important because it's going to find all of the best normal embryos in there. And if you're interested in knowing male versus female, you also can get that information and pick if you have a preference. And then the best normal embryo will then be transferred back in a later cycle to then get the patient or the surrogate pregnant. And so it's definitely kind of a complicated process. Typically the ovary stimulation part's about 2 weeks, and then the transfer part can be about a month or so depending on the protocol. Just to go a little bit more into the PGT, or pre-implantation genetic testing, definitely I would say now that is kind of the biggest technological advance that we definitely recommend, even with donor eggs, just because unfortunately a good number of embryos, even from young women, are still potentially abnormal. And by doing PGT, we're just going to maximize your success. We're going to know it's a normal chromosome embryo. And again, because gender is part of the chromosomes, if you are interested in picking a boy or a girl, you can do that. Additionally, in the case that we're looking for a genetic condition, so some people have certain carrier statuses of things such as BRCA, which causes breast cancer, or cystic fibrosis, or things like that. If that was something we wanted to test for and needed to test for, we would do that as well. Here on the slide, you can see interesting pictures of the embryos at all different stages. So you see day 1, that's just the egg and sperm that came together correctly, which is called a fertilized 2PN embryo. And then every day those cells are gonna multiply and divide and just continue to become what's called a blastocyst. So you can see day 2 and day 3, we're getting more and more cells. Day 4, those cells are starting to form into what's called a blastocyst. And then day 5, you'll see this beautiful picture. It's called a blastocyst embryo. That's what we're looking for. A lot of the cells have concentrated in this inner cell mass. That's going to become the baby's body. All the rest are lined up on the outside, which is called the trophectoderm. That's where this last picture is showing is taking just a couple of cells to do the genetic testing, which doesn't harm the embryo. And by doing that, like we said, we're going to pick all of the best ones. In most cycles, these embryos will then be frozen while we're waiting for results. And then in a later cycle, that embryo would be transferred to either a patient or a surrogate. However, definitely for international patients, I know it's hard to get here, and obviously right now with COVID, probably not right now, but definitely in the future, hopefully soon, we definitely could do this as a fresh transfer as well, depending on different schedules. So we figure all of that out. And then just in terms of a treatment timeline, so definitely I know with COVID things are hard, but definitely we work a lot with international patients. So definitely it would start with a consultation, which typically would be telehealth. So we could do a video chat, phone chat, however it may be. We have translators for all different languages so that we can make sure we can all communicate. But basically in that, we're going to go through an in-depth history all about kind of you or whoever's going to be involved with making embryos. And with that, we're then go through what testing needs to be done. And that testing can often be done where you live. We definitely try to pick and help you pick places that are kind of well-known so we can make sure we're getting good results. But really we, again, depending if it's going to be using your eggs or an egg donor, and if you're going to be carrying a pregnancy or more likely the surrogate, that's where we get all of this testing done. But it includes blood work, ultrasounds for male partners, semen analyses, we do genetic testing and all of that. At the end of all of this, we have our plan, we get our timeline ready, we do all of the consent forms, legal, all of that. And so we're ready to go. And then the IVF cycle, like we said, is to make the embryos. And once those embryos are made, we're using a surrogate. We then are doing surrogate screening. We're finding the healthiest women. We usually find women that have previously carried a pregnancy without difficulty. As your doctor, I would be screening that surrogate myself just to make sure that there's nothing that has changed or has been mixed. But Patriots Conceptions is great in screening and finding all of the best surrogates. And then basically once that surrogate is fully ready to go, she'll go through the transfer process, which is some pills, some injections. And at the end of that, we'll do the transfer, which is putting the embryo into the uterus. And then hopefully we're getting some good news about 2 weeks later. With that, typically surrogates or patients will stay with me as a fertility doctor until about 10 weeks of pregnancy. We do a lot closer monitoring than kind of regular OBGYNs. So we do a lot of blood tests in the beginning to make sure all the hormones are appropriately rising. And then usually we're due about 3 ultrasounds. And so as intended parents, typically outside of COVID, definitely we love having intended parents come to scans if they're local. Otherwise, definitely now in this world, definitely with COVID, we are doing more telehealth, but absolutely FaceTiming, video chats, taking videos, all of that is definitely encouraged so that you can really feel that you're part of the process. In terms of COVID-19, like we said, I know we keep referencing that. I am here in California. Unfortunately, right now, our case numbers are on the higher side. That being said, everything's being done to bring that down. And with the COVID-19 vaccine, we are excited to hopefully be combating this pandemic and starting to really see a decline in cases. Most of us medical professionals have already received both doses of the vaccine. And so at this point, we are vaccinated. Most of our staff have been vaccinated. And so just slowly, those numbers will come down. I actually was doing a talk for SEEDS, which is an American kind of ethical society on egg donors and surrogates, just a few days ago about COVID-19 and vaccines, and should egg donors or surrogates be trying to get these vaccines. And so just to talk about the COVID-19 vaccine, Definitely, there's been some kind of misinformation about it causing infertility. At this point in time, there is no data to support that. Animal studies have shown no data to support that. The physiology of the vaccine, which is using mRNA, which is basically telling your body to make antibodies against that protein, it goes away very quickly. So if your surrogate or egg donor was able to get the vaccine as a healthcare worker, definitely that would be recommended to decrease the chance of COVID-19. And then definitely, in pregnancy, just still taking precautions. But that's something we're assessing with any egg donor or surrogate or patient that we're working with. And then just in general, if you are coming into our office, we're taking all precautions against COVID-19, screening, temperatures. In the small case you were to get COVID, or the egg donor or the surrogate, that would be a reason we'd put the cycle on pause. But again, hopefully those case numbers are going to start going down. If you or the surrogate was to get COVID-19 in pregnancy, really at this point, the data is kind of mixed. Definitely, we don't think that it is a massive kind of increased risk, in terms of that to the baby. Definitely in a first trimester, we'd want to try to keep your fever down. But really past that, some studies are showing that maybe you'd get COVID a little bit more severe, but in general, pregnant women who do get COVID do well. So definitely something that we just take all precautions for, either, a surrogate or if you're the patient.
All right, thanks, Dr. Becht, for the overview of the in vitro fertilization here in the United States. And if you're thinking about doing a surrogacy or or IVF in general, or egg donation, I think right now is a good time to think about or to get a good consultation with if you intend to do it, it's good to plan ahead and get a consultation with a doctor. HRC does offer free consultation for the first time patient. And also take advantage of their current discount offering. I believe it's a $30,000 all-inclusive package that includes, your IVF cycle, medication, even the genetic testing. So right now it's because of COVID-19, they have such general offering. I think right now is a good time to take advantage of it. And also, if you like to get in touch with Dr. Becht, I'm going to send out the link on the center of your screen. You can click on the book now button. That leads you to HRC's website. If you come from other channels, YouTube, Facebook, or WeChat, reach out to our get we can help you out with that, or simply leave us an email address. We'll send out a mass email in this regard. And also, if you read the consultation form, there's also another, just take advantage of the promotional, on the consultation form, you can list all the stuff that you want to know ahead of time: egg freezing, egg donation, semen analysis, and Dr. Becht will get it all addressed during your initial consultation. And moving back to the surrogacy part, Dr. Becht already explained IVF and surrogate integrate each other. And first of all, the main concern about surrogacy is the cost. Here in California or United States in general, that ranges from anywhere from 10,000, 100,000 to 130,000, more or less, give or take, and that includes the surrogate screening and management fees. Legal fees consist of two parts. One is the surrogacy contract that when the surrogate mother passed the medical psychological screening, intended parents and a surrogate might have minor terms they have to agree upon. Majority of the contracts are generic, and in the United States, surrogacy is legal in, I believe it's 48 out of the 50 states. Right now, the only two states is very difficult, and New York, by the way, they just legalized the surrogacy. Well, matter of fact, not yet, but not quite yet. In 9 days, February 1st, New York's gonna become one of the legal states that legalize the commercial surrogacy too. Definitely a good news. So if you're from East, if you want to go to the East Coast, or you want to have a surrogate from the East Coast, it becomes achievable. And the second part is the parentage. Normally in California, and it differs from state too, is that in California, we call it pre-birth court order. So you get to establish your parentage before the children's birth. But in other states, you might have to do it post-birth. It's similar to adoption process where you have to show up at the court. The judge gonna ask, gonna ask you some question to see if you're fit to become a parent of the surrogate babies. But I say most of the states doesn't require post-birth court appearance. Majority of the states are like California, where you can do all the paperwork pre-birth, and it's just a matter of formality. Normally, the judge will get approved without any hassles, and you will be able to get it weeks ahead of the time. And so this part takes it's a surrogacy contract, and also the appointment of an independent attorney to review the contract with the surrogate mother, the PBO or post-birth court order, and also, of course, you have another review attorney that will review the legal document to make sure the surrogate mother understands the legal document too. That consists of the legal fees, and the surrogate benefit package includes a basic compensation that we pay directly to the surrogate, and also the surrogate mother also normally you will have a miscellaneous monthly allowance to reimburse the mileage that she traveled between her home and the clinic. There's going to be a bunch of appointments that she have to go to, IVF, OBGYN related, and the maternity clothing, the part. But even before she reached to this part, a lot of those fees are going to be covered in the management too. For example, her background check to check the federal, state, and the county level court record to see if she has any criminal association in the past. Her credit score to make sure she doesn't have any outstanding financial debt. The medical record request and a review. Of course, we have a secure system, the HIPAA compliant, to protect patient privacy, and that would then once we get it, we will have a registered nurse to review all her medical record to list all the pre-existing problems, and the HRC will have a further review to determine if she's suitable to become a surrogate mother. And also during this process, I think it's the next part is during this process. So of course we also do a psychological screening to make sure she's mentally fit to become a surrogate. That will consist of a personality test. Normally, they will have a questionnaire from either Minnesota, or it's called a personality inventory, where to test a personality. Then they will have a secure video chat or in-person chat to determine if she's mentally fit. And during the whole process, of course, there's a lot of communication between us, the clinic, and the surrogate to make sure, it's hard to imagine, but surrogate normally have tons of questions, especially when the first time they did their, injectable medication. Some surrogates scared of needles, some doesn't, and the clinic and us will get this part taken care of. After the 10 weeks, at the IVF clinic. So normally after her legal clearance, after the surrogacy contract is established, she will be monitored at the IVF clinic. She will take the injectable medication and to prepare for her frozen embryo transfer. And the whole process takes about 10 weeks. After the transfer, after the continuing monitoring, with the IVF clinic, after 10 weeks, we call it graduation from the IVF. Then she will go to a regular OBGYN clinic for the remainder of her pregnancy. So, and at that point too, we will also notify our attorney. She graduated from the IVF, and now it's time to do her pre-birth court order. Or if she's from one of the post-birth state, we will also get it prepared. For example, there's one of the rare cases in state of Idaho where they do the post-birth, that we will also need to submit all her psychological evaluation, not just theirs, but also intended parents, because when those states want us to prove that those parents are mentally and physically and financially fit to raise the child. And after 9 to 10 weeks of pregnancy and pre-birth, post-birth, parentage establishment, eventually you will get a certificate of birth that will have your names as the legal parents and to view the family with a lifetime joy. And also to take a, let's see. And also we do offer a few financing options here in Patriot Conceptions. So we do, HRC does that part for the, if you're a domestic US-based customer, we do offer that option too. If you have a US-based credit score, we partner with the different financial institutions, and depend on your credit score, you can get as low as a 3.6 APR and up to 10,000, 100,000 with terms up to 84 months. So it has some generous offering, and also there are a bunch of other, financing options. When you talk to either HRC or us, we'll tell you, there's right now you can if you have real estate properties and you have a passive equity, cash out refinance, home equity loan, those are better options, with a lower interest and a longer term for you to pay off the debt. And if you, HRC is one of the, is also one of the chain that accept, progeny. If you work for one of the big tech company or whoever partner with the progeny or care fertility, I think HRC also participate in that too, to help you financially. And that's my part of the presentation. I think before we move to the FAQ section, I think right now the main the customer's main question, especially from the WeChat, Chinese side, is the international guest side is then, how the legal part of, the legal and the ethical part of the surrogacy, and also from IVF perspective, the patient, international patient in countries like China, they couldn't choose, the gender of the embryo where they, that they want to transfer. There's no, the doctor just wouldn't tell them, the gender, of certain embryo. And genetic testing is available, but it's not widely available. So there's a certain part of the country that does it, it doesn't do it. And I think those are all an advantage for you to come to the U.S. If you consider about in vitro fertilization, and just in general, HRC's success rate, I think is across the board is is one of the top in the nation. So again, if you like to do that, you can don't miss this opportunity for the free consultation. And if you like to take a look at the surrogate profile, you can do that too by going to the center of your screen and click on Learn More. That will lead you to our profile system. Online profile system, and of course you will be prompted to sign up to view the detailed profile. It requires a very minimal information, and our intake specialist will talk to you to validate your identity. Then you will be given the permission to view the detailed profile. Okay, and let's see if any okay, I think that concludes my part of the presentation too. Again, thank you so much. We like to move on to the FAQ sessions, and our mediator will relay any message, any questions that are coming from other channels, Facebook and YouTube.
So it looks like we have a question from our kind of internal webinar chat asking, how does the medication work for the IVF cycle? So the medication sometimes might start off with a little bit of birth control pills, depending on your specific personal hormone levels and everything. And then from there, injections are typically about 10 days. They're what we call subcutaneous, so a very small, thin needle. If you've ever seen someone give insulin, that's the same needle. We would teach you how to do that, or we could teach someone else how to do that, or sometimes if you don't feel comfortable, sometimes a visiting nurse could do that for you. But those injections are done every night for, again, ran about 10 nights. You come every couple of mornings, and from that, we're able to figure out what to do with the dosing. In terms of side effects, sometimes maybe minor headaches and mood changes to start. As hopefully the ovaries are responding well, that's when sometimes you definitely will feel more kind of pressure and cramping. But for the most part, people feel pretty good after they do the first night of medications. They feel confident doing that. And most people look back and feel the side effects were less than they anticipated, which is great. In terms of some kind of common questions about the medications, a big question is will the medications cause cancer? The answer is no. There's been many studies. We know in general for certain factors that could lead to infertility, for example, endometriosis, that on its own is a slightly increased risk of certain types of cancers. So in some IVF studies, we see that, but we don't think it's the IVF itself or the medications. And before moving into a cycle, if there was any cause for concern for any type of, for example, breast mass or anything like that, that would be something we would have you look into just to make sure you're fully healthy before doing injections. It looks like another question is about COVID. In terms of COVID, in terms of that kind of question, definitely if you were to contract COVID, absolutely we would put your cycle on hold. Here in the United States, most pharmacies actually have programs for people that do test positive for COVID to basically give back the medications you had used when you then were found to be positive for COVID. So typically we would just stop the cycle, make sure you're recovered, which for many people that are healthy, it maybe would be a couple weeks and we'd start again the next month. Definitely in terms of COVID in this whole process, it definitely has caused some issues in that typically, anyone is welcome to come to appointments in terms of support and things like that. But really at this point, we've really kind of figured out, how to socially distance in the waiting room. Everyone's wearing masks and things like that. So we've had no cases of anyone contracting COVID from our office. And all of our patients have been very, respectful in telling us if they have any concern that they themselves or someone close to them has been exposed or has been tested positive. So we feel that it's a very safe environment. Also here at HRC Newport Beach, we're actually located at Hoag, which is the best hospital in Orange County. It's kind of well known in the United States. And because we're on Hoag's campus, to actually even get into our office, you have to screen through the Hoag Hospital guard. So we make sure anyone coming in is definitely very healthy. So there should be no cause for concern to get COVID. Definitely if you're an international patient, at this time, obviously it is a harder kind of process. And so that would be something where we could at least do a consult, get things ready to go. And the thought is cases are already starting to kind of slowly go down. So maybe in a couple months would be a better time to do it. I see there's a question about where the embryo is stored. That's a fantastic question. That's something you always want to think about when you're picking a place to do any type of fertility treatment. Our embryos are stored right in the same lab that they are created. There is no transport whatsoever. Our lab is fantastic. You can go on our website, but it's all glass internally. So as you walk by to go get procedures and things like that, you can actually see the embryologist working in the lab. All the liquid nitrogen tanks where the embryos are stored are literally in a perimeter around our lab. So they're always being watched. So they're being watched in all different ways. So if there's ever any type of a liquid nitrogen leak or failure beyond just kind of the normal monitoring, our embryologist would actually see it personally. So that's definitely much superior to places that ship embryos elsewhere to be stored off-site and then have to be shipped back when you're ready for a transfer. So definitely on-site storage is great just for any type of potential issue. How long can embryo be stored? They're all in liquid nitrogen. So theoretically, I would say indefinitely. In terms of cutoffs, for someone carrying a pregnancy, just from a health perspective, we typically would cut off at age 55, kind of after 45. Definitely you would just need proper clearance and screening to carry that pregnancy. But those embryos are just as good and successful right when they're frozen versus a few years or 10 years or 20 years later. And that's all kind of with our current technology. Definitely if you were, for example, getting an adopted embryo from many years ago, that might be a little bit different. But with our current technology and what we call vitrification, which is how we are going to freeze them, they are indefinitely good.
And Dr. Becht, from other platform, one of the question is, okay, I think it's for herself. This one is from Facebook, so I think she's not intended to use surrogacy, but will IVF significantly increase my chances of having twins or triplets?
So that is a fantastic question. So at this point in time in the United States, doing pre-implantation genetic testing, which is that PGT, is really considered standard of care. And with doing that, we are going to segregate out the good normal embryos we want to transfer from ones we don't. And by doing that, we have very high success rates on just one embryo when we transfer, like we said, 75+%. So our recommendation is one embryo at a time. There's a very, very small chance that one embryo, once it's already in your body, actually then split to become identical twins. That's about 0.7, so less than 1%, so very unlikely. Back in years past, like 5+ years ago, when PGT was not routinely done for all people doing IVF, yes, if someone was of higher age, sometimes we put back 2 or even 3 embryos, with the thought being, well, only maybe one would be normal, and sometimes more than one was normal. So definitely our priority now is PGT, one embryo at a time, very small risk of twins. If someone wanted twins, we could put back 2 embryos, understanding the risks of twins, and then you'd have a high chance of twins. But in terms of unexpectedly getting twins, or definitely more than twins, that's very, very rare nowadays. Again, that's the United States standard of protocol because we have such high success rates. Definitely in different places where PGT might not be as common, that could be a little bit different. Looks like we have a question from our webinar. Says, if you're local, are we doing inpatient consults? So the great news is we are. So if someone wants to do an in-person consult, we absolutely welcome you and your partner to come in. We can do that. We can do telehealth. We can do phone, whatever you feel most comfortable with. Kind of the question about would we be closed? Just to answer that, in the United States, back in March, when COVID-19 really became a huge kind of issue, most fertility practices did kind of shut down for the most part for a few weeks while everything was being figured out. But then really kind of the American Society of Reproductive Medicine stated that if we were not taking kind of resources away from, vital hospitals and things like that, we could reopen, because at that point fertility was deemed essential, which is where it should be, as fertility is definitely a time-sensitive issue. And so at this point, if you have a private practice with full support for your surgery center, you can remain open. So HRC is actually one of the only places kind of in our area that has that type of support. Again, I can never say never, but I would say less than a 1% chance that we would shut down. And that would only be in the small case that we could not operate our surgery center because we had no hospital backup. But we do have right now backup from Hoag Hospital in the very small case there was an emergency, which is a criteria to be able to stay open. So I do not anticipate any shutdowns. At this point, actually, COVID, at least in Orange County in the Newport Beach area, is slowly starting to come down, and with pretty much all healthcare workers. And now we're vaccinating other essential workers, elderly patients. At this point, hopefully the pandemic is really taking a turn for the better. And so I have no anticipation that we would shut down. So at this point, everything is open. There are some restrictions in terms of partners at future kind of visits, but definitely any of the important visits like a pregnancy scan, a transfer, partners can come as well.
All right, Dr. Becht, from other platform, one of the question is that are there any restrictions while undergoing IVF? And she also follow up with another one is during the IVF process, is there any side effect? I'm afraid of all the hormone injections. And of course, there's the long-term effect of ovarian stimulation, even though it's for a short period of time.
So great questions. We kind of just touched base on the meds, but basically in terms of side effects, maybe minor headaches, minor mood changes, definitely as the ovaries hopefully grow with a good response, some pressure, some cramping, some bloating. But all of that will typically go away within at least a few days, if not a week from after the egg retrieval. And so by the time you get your first bleed after egg retrieval, which is about a week and a half to 2 weeks after, most women are pretty much back to their normal. And at that point, the ovaries have shrunk back down to normal. So there is no long-term effect. Everything is done under ultrasound guidance, so the kind of risk of a complication like an infection or puncture of a bladder or the bowel or anything like that is extremely rare. Those are all things definitely we go through in a history just to make sure that you specifically are not at higher risk for any of that. I would say the one thing that some women that are a little bit younger have great ovarian reserve, they could be at a little higher risk for what's called ovarian hyperstimulation syndrome, which is when you get many, many eggs, but with that you get more bloating, and maybe you would be feeling more bloating for longer than a couple of days. But that's something we will pick up as a risk factor from your testing, and I would treat you specifically with special trigger shots, sometimes some additional medications. And I also like to do the ultrasounds for my patients, so I'm always kind of touching base throughout the cycle doing these ultrasounds, so that throughout it, if it looks like we need to go down on your meds because you're going to hyperstim or anything like that, absolutely we do our best to tailor and personalize every cycle to you to minimize effects. And then, like we said, there's been no studies definitively saying there's any increased risk of cancer or anything like that. So we do say IVF is a very safe process. And then in terms of kind of restrictions during that, definitely we would just say, once your follicles are starting to grow, no major exercise where the ovaries might be twisting, and no intercourse. And that would be about a week before the egg retrieval and about a week after. But other than that, we would just say be as healthy as possible. Definitely minimize alcohol intake, minimize caffeine intake, you kind of anything you could think of to just be more healthy.
All right. On the webinar program, Dr. Becht is like, if I got a vaccine, should I wait for a while to start the cycle?
So that's a great question. So really, there's not great data about it, but the thought is that if you have gotten now the second dose of the vaccine, really, if you did have any type of kind of fevers, inflammation, kind of the autoimmune response, probably within about a week or so, it should be kind of pretty much back to normal. So if someone has gotten both doses, we would say you could start within a month after. If someone felt very strongly, there are some people thinking that you could even start during that. My personal kind of opinion, and especially I got the second dose and did not feel the best for about a day. I do think that ideally, because we can plan out when we do treatment, I would get both doses of the vaccine prior to going to an IVF cycle. And absolutely, I'd wait a month before doing a transfer cycle with the thought that, all of that autoimmune kind of release and kind of that whole kind of potential inflammation we want that to calm down before we do a transfer. So fantastic if you can get the vaccine. And like we said, we kind of figure things out around it. Let's see. A free new patient consultation. So you can just go to the regular website. People are asking how to book a free consult, and you can just put in that you attended the Patriots Conception webinar, and my call center also knows for that.
Okay.
On this handy dandy link.
Yes. There you go. And Dr. Becht from YouTube channel, they were asking, one of the audiences was asking, I saw some advertisement promoting mini IVF or natural IVF. Is that what are they exactly? And do you personally recommend those programs?
So those are great questions. So there really are, I would say, kind of two schools of thought in IVF. Kind of most of us fertility doctors kind of fall into the kind of conventional IVF theory, including myself, which is, I would rather you hopefully maybe go through IVF just one time. I would give you a little bit higher dose of medications to try to get all of your eggs to grow, but I monitor you very closely. I tailor the medications throughout so that we don't get an over response. And the thought is by doing that, we get as many eggs as we can safely get from your ovaries, just because there's a lot of what we call dropout in an IVF cycle. So let's say we get 20 eggs. Not every single one of those is going to be a good, usable, mature egg. Let's say 18 of them are. When we then do ICSI, which is meaning putting the sperm into the egg, typically there's about an 80% fertilization rate. And I'm giving out statistics and averages definitely at a consult. Knowing your information, I could give you more specific to you. But like we said, we went from 20, we went to 18 to ICSI, and let's say now we're at 15 that came together as an embryo. Depending on age, when we grow out the embryo to blastocyst, depending on age, up to about a half could drop out. So for someone kind of over 35, again, there could be a good 50% dropping out. Over 40, it could be a little bit more than that. And so the thought is let's say we get about kind of 8 embryos at the end of all of this. Those are what we call blastocysts. Those are those nice big embryos that we're going to then take a few cells from the outside. And then based on age, we're going to see a lot more dropout. So kind of in kind of the younger 30s, hopefully kind of about about 50% or so will be normal. But once we get to the higher 30s, unfortunately, maybe only about 35-40% will be normal. Kind of over 40, at that point, we're talking more like maybe only 1 out of every 4 embryos will be normal. So there's a huge dropout. And so I would rather you do 1 cycle and hopefully we get at least 1 good usable embryo. Again, this is all specific to you and your age and what your ovaries look like. Definitely some patients do 1 cycle or a donor egg cycle and they get many, many nice normal chromosome usable embryos. But sometimes someone who's older with kind of lower ovarian reserve, we might just get 1 normal. And so the thought is I'd rather start with as many as we can get, and definitely hopefully get you a good embryo. Whereas natural or mini IVF, the thought is that you're just doing either low dose injections or sometimes pills, or just following your natural ovulation for 1 egg. And so the concern is you do all of this monitoring and time and emotion to maybe get 1 egg that, like we said, there's all this dropout. So the chance of that 1 egg becoming a good usable embryo is definitely on the low side. And so again, sometimes someone might not work with conventional IVF, and then that could be an option in the future. But I would say for most patients, and again, at a consult, we could go through your specific situation. Most patients with a well-monitored cycle at a high-quality IVF center typically will do better with a conventional IVF cycle. Again, we're not trying to overstimulate, and really the thought is we're trying to just be more efficient for you so that your body's not going through many, many, many cycles to eventually maybe get 1 embryo.
Let's see. One other question from this one's from WeChat. So, why do I have to take birth control before steaming?
So that's a great question. So again, at least for me, I like to personalize everybody's protocol to them and their levels. But for most women, especially as we maybe get a little bit older, depending on your hormones, you have your ovaries, you have all these little black circles called follicles where the eggs are. And even prior to getting your period, typically one of those has predestined itself to be the egg that's going to come out and ovulate for you next month. And so if with your period, we go right into injections, for a lot of women, we see that one takes more meds and grows faster. And we typically have to then trigger and do an egg retrieval a little bit earlier so you don't ovulate. And in doing that, we typically get less eggs. Again, I personalize to everybody. So definitely if it made sense to go right into a cycle, we can. There are some places that put you on birth control for long periods of time solely to schedule you. Definitely, I don't believe in that. That is something where I'm only having you take a week or 2. Again, really to synchronize follicles to get the best response, not to schedule. That being said, that week or 2 birth control does allow a little bit more flexibility, especially if you're international, to travel. So on that kind of alone, that's a little bit, less stress than, waiting for your period to jump on a plane. So definitely for traveling, that definitely is helpful. But like I said, for almost all women, just based on your hormones and your age, again, depending what you're doing, typically we do birth control. And it's kind of both subsets, because we also see young women, for example, donors, they do better with birth control too, because they have so many follicles that if we go into injections, sometimes only some of them will take the meds. But again, it's, at least for my practice, I personalize it based on your hormones, your ultrasound, and exactly kind of everything that goes into making a good protocol for you.
Well, I don't have any further questions from other channels, but yeah, it's been a very informative, educational webinar. Thank you so much, Dr. Becht, for all the, for your presentation, all the detailed explanation of IVF process, and all the answers to the audience's question. And yeah, it's a challenging time, but the good news is we're implementing the vaccines across the states. And they're probably it's probably going to be expedited, accelerated, and not to mention we have Johnson & Johnson, which have a single dose, cheaper vaccines that have yet to be released. So with all those different manufacturers, the the ramp up of the total quantity of vaccine, things going to turn around pretty quickly in the States. So hopefully in June, July, everything will back to semi-normal, if not complete normal. And regarding the legality of surrogacy, it's been practiced. I believe California it's been practiced gestational surrogacy since 1980s. Later part of 1980s. The first contract was drafted back in 1978. 87. I'm sorry. And and we have a pretty good legal system to protect both you and the surrogates, right? And as well as the donors if they are involved. So there's really not much to worry about, but being a parent in general is a very serious question you have to think over. That's our response to the celebrities, recent celebrities news. Being a parent is meaning more responsibility, obligations that you have to be prepared to bear those obligations until the children reach their adulthood. That's something you need to consider about seriously before you jump to the option where you want to choose to become to be a parent. That concludes our. If you have a further question, feel free to shoot us an email, and also the here we listed both our Instagram's account. You can come get on there, book appointment. I'm gonna send out the link one more time if you want to have a chance to win a free consultation with Dr. Becht. Fill out the information, or you can call to the call center directly and mention that to enter a chance to win a free consultation. Thanks so much for tuning in today, and we look forward to seeing you in our next webinar.
Absolutely. It was so nice talking to everyone.
Thanks, Dr. Becht. Bye.
Bye. Bye.
Bye.